Hello everyone, welcome to today's video, and we are talking about malaria disease and the newly launched malaria vaccine in Uganda. And malaria is an acute febrile illness caused by plasmodium and mainly spread by mosquitoes. There are so many species of plasmodium, the leading being plasmodium falciparum, which is the leading causes of malaria cases in Uganda and Africa altogether. Other species of plasmodium include plasmodium ovale, plasmodium vivax, plasmodium knowlesi, and plasmodium malariae, all which affect red blood cells and causing malaria. And patients' malaria normally present with an acute intermittent high-grade fever associated with chills, joint aches, body aches, vomiting, and sometimes diarrhea in some children. The symptoms vary depending on the severity of the illness. In terms of severe cases, you might have babies or children getting convulsions, getting heamaturias, and other severe symptoms. And in Uganda, malaria is the leading cause of illness and death amongst young children, and by percentage, 40% of the people who visit hospitals for O.P.D services are always diagnosed with malaria. 25% of people who visit of the hospital admissions are malaria cases, and 14% of all hospital deaths in Uganda are due to malaria. And that's according to the data by World Health Organization in 2022. And also, according to the 2023 World Health Organization rankings, Uganda was found to be amongst the 5 first countries having the highest prevalence of malaria, which included Uganda, Democratic Republic of Congo, Mozambique, Ethiopia, and others followed depending on their prevalences. However, the good news is that the malaria vaccine was invented, and on 2nd April 2025, it was launched in Uganda. There are basically 2 types of malaria vaccines. You have malaria vaccine RTS/ASOL and R21/Matrix-M. All the 2 vaccines have been authorized and recommended by World Health Organization and are expected to reduce the malaria burden in Uganda by targeting children between 6 to 18 months, 6 months to 18 months, and all those are the children who will be vaccinated against the malaria disease. Meaning, we are expecting that the malaria vaccine is going to cover up to 1.1 million children who are less than 5 years, that is 2 years and below. And the vaccine has mainly 4 shots. Thereby you have the first shot at 6 months, the second shot at 7 months, the third shot at 8 months, and also the last shot at 18 months. It's expected that following the above vaccination, we shall have the prevalence of malaria and mortality of malaria in Uganda reducing as expected by the Ministry of Health. However, there are so many communities in Uganda and so many disadvantaged people who still are experiencing the burden of malaria. Because if a child of 1 year is infected by plasmodium and falciparum malaria, that child will need to visit a government facility for free medical services. However, sometimes it's really challenging for them to reach facilities due to the distance and also due to the emergencies of the condition. For example, a child might present with convulsions, heamaturia. So the nearest facility might be a private health facility, which is always expected to charge approximately 100,000 shillings for a 1-year-old child. That's for management of severe malaria, which is really a burden to the people who are needy and disadvantaged. We therefore focus at giving a helping hand to children and people from disadvantaged regions through delivering free medical services to the population. We at Nalondo Medical Foundation therefore request for partners, request for friends, request for sponsors who would like to invest in charitable medical services to the community, to subscribe to our channel, donate to us, and follow us for our community programs, whereby we are hoping to donate 1,000 mosquito nets by the end of this year in a way of preventing malaria amongst children and adults of a disadvantaged origin. Together with other community programs of the NGO, we request you to support us and follow us in our activities as we post them on our social platform. Thank you and see you in our next video. However, we encourage all Ugandans having children below 2 years to visit public facilities for vaccination against malaria. Thank you and see you in our next video. Bye-bye.